What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
And welcome back. Well, today from Hoag Medical Group, we have Dr. Mercedes Tamioka.
Yes.
Is that correct? And you are not only internal medicine, but you're also geriatric medicine for the Hoag Medical Group. Nice to have you on today.
Thank you very much. Good morning, Ken. Good morning, everybody. I'm really happy to be here and answer any questions.
All right, you told me right before we started you've been with Hoag since May. What is your background? Where did you get your training and all?
So I am originally born and raised in South America, Lima, Peru. I completed.
I never would have guessed that.
Yeah, that's why my name is Mercedes.
Okay.
And, so I went med school over there and came here for the training in internal medicine in New York, and then pursue one extra year in fellowship in geriatrics at UC Davis.
Oh, very nice.
And then after I've been in over practice as a primary care over 10 years, different settings, a rural area, and also private practice, and HMO system too. And finally joined Hoag because I personally identify myself with the strategy plan and with the philosophy of patient-centered care.
All right, very good. Yeah, people usually go to UC Davis. I know they have a very good geriatric program up there, don't they?
Yeah.
And if you want to go into the wine business, they have that too, right?
That's
All
true.
right. Well, you know, what is the difference? There's usually, you know, in this community, we hear about commonly 3 different practices as far as medicine goes: family medicine, internal medicine, and geriatric medicine. And you're covering internal medicine and geriatric medicine. What is the difference between the 2 of those?
Well, basically, family medicine and internal medicine, you see adult population. Family medicine, it's more broad. I mean, they see pediatrics, children. They also can see OBGYN patients, I mean, pregnant patients. Sometimes they do surgical procedures. Internal medicine is more focused on adult and on chronic medical conditions. Geriatrics is subspecialty, could be from family medicine or from internal medicine. And basically you focus on the preventive health and diseases related to older population.
Okay. So one of the things that obviously you cover are basic, I guess you would call it annual visits or wellness visits, or throughout the year. Many of the people here are on different types of Medicare plans, and part of that is to go in for whether it's a physical or all the other necessary scans and tests that are preventative. And it sounds like that's something that you would be doing.
The thing is that after age, so the senior citizen population is defined by Medicare. So after you turn 65, you don't get any more annual physicals. Unfortunately, it's not paid by Medicare. But what it's paid by Medicare, it's wellness, annual visits, and welcome, the first one. So, and that includes, I mean, the doctor usually updates your past medical history, your medication list, make sure your height, weight, and blood pressure is stable. Also address things like depression, memory problems, and also give you choices about end of life, you know, advanced directives, and some other you know, choices that you have in the community depending on the chronic condition that you have. No?
So instead of once you get on Medicare, what you would call your annual physical, you certainly see the doctor, but it's more about specific needs then.
Right. So at this time, I mean, what we usually evaluate, it's activity of daily livings. We evaluate also mobility, your risk for falls. We also evaluate memory problems, risk for depression, and also the most important thing is the goal is to keep the patient independent and prevent diseases.
So when the patient comes to you for the first time, what is it that you would prefer them to have available to you to bring as far as the information, the medications that they may be taking or not taking? And you know, if they see you as they just are getting on Medicare, in many cases they may be very, very healthy.
Yeah, well, the first thing that I do when I see a new patient is I try to get the more information that I have about the patient, about his past medical condition. It's different if the patient has been healthy or with minimal medical problems rather than if the patient has been a smoker or, you know, asthma or congestive heart failure, heart problems, or diabetic. So it's different. So I try to gather the majority of the information. Another thing that I focus on is medication list. So polypharmacy is something that we need to be careful in this population, because sometimes, I mean, they take 8, 10 medications, including over-the-counter medications, and they interact one to each other, and sometimes the symptoms that they complain, it's side effects from some of the medications. So very important. Third thing that I assess is fall risk, so mobility, how good they are, they're physically active. I mean, do they do exercise? How is the weight, the body mass index? Because all these things may affect the mobility. Arthritis also, if they are in pain. And the third thing important is cognition. So depression and memory problems is something that should be addressed also as well.
Obviously, you go over family history. In many cases, if somebody's seeing you for the first time, and again, they might just be 64 and a half, 65, and they can get on Medicare, they may have parents that are still alive. And so with that, they have a really good knowledge of what their parents have gone through, and then you would evaluate that as well.
Right, definitely. So past medical history, family history, anything that happened in the past, I mean, in their life, it's important to gather. So that's part of what I call past medical history. But of course, family history, it's important. Genetics, I mean, contributes a lot also on prevention of diseases as well.
What other kind of services does a geriatrician provide and information? Are you there just to, if a patient comes in or a group comes in, and just gives them an overall evaluation of the types of things they should be looking for as they age, and they're addressing the different needs that they may have?
So, for example, we have a senior clinic in Hoag Medical Group, and on top of the medical things that we address, we also address living facilities, for example. I mean, depending on the health condition and how physically active the patient is, we suggest different facilities for living condition. If they are really independent, and we make sure that there is no risk, that the home is safe for them and no fall risk, then that's okay. But if they need some services, we can provide that. Usually, I mean, we try to work with a social worker or case manager so we can give choices for the patient. Another thing that we address is advanced directive, which is end-of-life counseling. I think that's very important because there is a time that if you are not, if you never express your wishes how do you want to be treated in the future when you cannot express, it's difficult. So very important to address that with your doctor. Doesn't have to be your geriatrician, but very important to do it. Mm-hmm.
Yeah, so you offer an awful lot, and when you start seeing someone, you can end up seeing them for many, many years to come. And as they age and their needs become different, you're like the go-to person that you can evaluate and then send them off to any specialist that they may need. Yeah,
definitely. I mean, a lot of my patients, they are 55. I mean, before they are Medicare, but they are, I mean, foreseeing that age, and they say, I mean, they really want to prevent diseases. They really want to keep independent. They really want to keep in good shape.
Yeah.
So, yeah. Mm-hmm.
Very good. Well, it's been a pleasure to have you on. And if you'd like to get a hold of Dr. Tomioka, you can. And she is part of the Hoag Medical Group. The number's on the screen for the medical group, 791-3101. You can go online to hoagmedicalgroup.com, and from there, they can help you out. And I appreciate you coming on. Great information.
Thank you very much.
Nice to meet you.
Nice to meet you.
We'll be back in just a moment.
What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.